Question 1. Which of the following is a classic feature of Guillain-Barré syndrome, GBS? A. Progressive muscle weakness starting in the lower limbs. B. Excessive sweating and increased salivation. C. Impaired memory and cognitive decline. D. Seizures and loss of consciousness. Answer. A. Progressive muscle weakness starting in the lower limbs. Explanation. Guillain-Barré syndrome typically presents with ascending muscle weakness, beginning in the lower limbs and spreading upward. It is an autoimmune condition that affects the peripheral nervous system and is often preceded by an infection. Excessive sweating, cognitive decline, seizures, and loss of consciousness are not characteristic features of GBS. Clinical scenario 2, a 45-year-old male presents with recurrent episodes of sudden, severe headache associated with nausea, vomiting, and photophobia. He describes the headache as the worst headache of my life. On physical examination, there is nuchal rigidity. What is the most likely diagnosis? A. Migraine. B. Tension-type headache. C. Cluster headache. D. Subarachnoid hemorrhage. Answer. Subarachnoid hemorrhage. Explanation. This patient's symptoms, including the sudden onset of a severe headache, nuchal rigidity, and the description of the worst headache of my life, are highly suggestive of a subarachnoid hemorrhage, often caused by the rupture of a cerebral aneurysm. Question 3. A newborn is diagnosed with a myelomeningocele. What is the most appropriate initial management? A. Immediate surgical repair. B. Observation and conservative management. C. Antibiotic therapy. D. Placement of a ventriculoperitoneal shunt. Answer. A. Immediate surgical repair. Explanation. A myelomeningocele should undergo immediate surgical repair to prevent infection and further damage to the exposed neural tissue. Question 4. A child with phenylketonuria, PKU, requires dietary management to prevent intellectual disability. Which dietary components should be restricted in PKU management? A. Carbohydrates. B. Fat. C. Proteins. D. Fiber. Answer. C. Proteins. Explanation. In PKU management, dietary protein intake, specifically phenylalanine, should be restricted to prevent intellectual disability. Question 5. Which of the following medications is associated with the development of myopathy and may present with leg pain as a symptom? A. Aspirin. B. Ibuprofen. C. Statins. D. Acetaminophen. Answer. C. Statins. Explanation. Statins, commonly used for lowering cholesterol, can be associated with myopathy, which may manifest as muscle pain or weakness, including leg pain. Question 6. In a patient with suspected sciatica, which of the following maneuvers is most likely to exacerbate the leg pain and provide diagnostic information? A. Straight leg raise test. B. Trendelenburg test. C. Tinel sign. D. Phelan test. Answer. A. Straight leg raise test. Explanation. The straight leg raise test is used to provoke sciatic nerve pain, and a positive test, exacerbation of leg pain, is suggestive of sciatica. Clinical scenario 7. A 45-year-old man presents with sudden onset severe right flank pain that radiates to the groin. He reports nausea and vomiting. On examination, he is in significant distress and has costovertebral angle tenderness. Urinalysis shows hematuria. What is the most likely diagnosis, and what is the initial diagnostic test of choice? A. Renal cell carcinoma, order a CT urogram. B. Acute appendicitis, perform an abdominal ultrasound. C. Kidney stone, renal calculus, perform a non-contrast CT scan. D. pyelonephritis, order a urine culture and sensitivity. E. Inguinal hernia, perform a physical examination. Answer. C. Kidney stone, renal calculus, perform a non-contrast CT scan. Explanation. This patient presentation with severe flank pain, nausea, vomiting, costovertebral angle tenderness, hematuria, and a high suspicion of a kidney stone, renal calculus. The initial diagnostic test of choice for confirming the diagnosis and assessing stone size and location is a non-contrast CT scan. Renal cell carcinoma typically presents with different clinical features and is not the most likely diagnosis in this context.